I'm here at Annie Penn Hospital today, and I'm had the pleasure of speaking with Mona Easter. So Mona, I know you've been here for a while, had a lot of different roles. Could you tell us a little bit about your career and your current position?
Absolutely. So I have been here for 43 years. And I started out at the bedside nurse, and did that for a while, worked medical surgical, critical care, emergency department, done a little bit of everything. Then I promoted up to the house supervisor. Then the next job I had was director of the ICU and the med-surg department, and then chief nursing officer, and now I'm the chief nursing officer and vice president of operations here at Annie Penn.
So a lot of important jobs, and we're glad to have you. So you've been here 43 years. That's not quite half of Annie Penn's time. I think the hospital was 93.
Yes, 93.
Oh, it feels like you've been here 93 years.
Well, I've seen a lot of changes over the course of time. I tell a lot of nurses now who have never worked without an IV pump that I started before the IV pump was invented.
Yeah, age yourself a little bit. Well, they wouldn't be able to tell it if you didn't tell them.
That's right.
Well, so Annie Penn's actually 93 years old, it was dedicated in 1930 on Mother's Day.
That's correct.
So May 11th, 1930, and it was Charles and Jeff Penn that really were the benefactors to build the hospital.
That's right, in honor of their mother,
Annie Penn. So Annie Penn, who actually was really known as a humanitarian. I think Miss Penn died in 1917, so she wasn't here at the time, but they gave the money and the land to build it in her memory. So that's where the name comes from. Obviously, the Penns are associated with tobacco, so like most of Reidsville is where the founding came from. But the hospital's still standing after the tobacco business is not. So.
Right. And we're so grateful to be here so that we can make sure that we're able to keep healthcare local for our citizens.
Right.
Yeah.
And so Annie Penn actually merged with Cone.
In 2001.
2001. Okay, so over 20 years now.
Yes.
And what does Annie Penn actually, there's some pieces of medical service that they specialize in at this location?
So we specialize in general surgery. We do orthopedics. We do major joints, hips, and knees here. We have an oncology department. We provide medical oncology infusions. We don't do any radiation, but we do chemo treatment. Gastroenterology, urology, nephrology. So we have lots of different specialties here at Annie Penn, and I think a lot of people don't realize that we have those specialties here.
Right. And being part of the Cone network, you have access to all of Cone's specialties.
Yes, absolutely, which is really, really beneficial to our citizens here, our community, to be able to have that very specialized care available to them.
Now, I know, I remember one of the things was when no longer having live births, planned births here at Annie Penn, because Cone has Women's Hospital that provides those services. So that was one change, I guess, several years ago.
That will happen probably in the mid-2000s, maybe 2010 or somewhere around there.
By specializing in certain things, you can give almost a better level of care on some things because you're not spread so thin.
Exactly.
Well, is there any new programs or outreach you guys have going right now?
Well, we're always working with our community. Right now, we're involved with the whole behavioral health assessment that's going on with the county. So really excited about that work because there is a big gap in behavioral health in Rockingham County, and not just in Rockingham County, but all over the nation. There's some definite needs for behavioral health care. So we're happy to be a part of that work. We're also part of the Digital Access Coalition. We work closely with our high schools. We support the school nursing programs. We work closely with the Free Clinic of Reidsville and surrounding area. We support them as well, and the Clara F. Gunn Clinic, which is a community outreach clinic. We have congregational nurses that actually go out into our community and work in different locations to help with screening and providing health care.
Well, you know, hospital's always an important part of the community, but as you just listed those few things, it's really easy to see that Annie Penn's still a huge part of Reidsville, Rockingham County, and the region here.
Yeah.
I know people are always wondering how doctors find Reidsville, and I know the hospital does part of that recruitment.
We do. So we actually, Cone Health has a large physician and provider recruitment department. So they actually, for lack of better terms, send out that net. And we do an assessment of our needs. We look at, you know, what is needed as far as care in Rockingham County and what type of providers we need to provide that care. We look at, you know, who's retiring, what's the future look like. So it's a needs assessment, and we base recruitment on those needs assessments.
Okay. And our hospital is an award-winning hospital.
Absolutely. So that's something I'm extremely proud of about Annie Penn, is that we are recognized not only locally but nationally for the quality of care that we provide. We have a 5-star rating for the Centers of Medicare and Medicaid, and that's the highest rating you can get. And that's based on patient experience, patient health outcomes from the care they receive. We have received a grade of A from Leapfrog for the last 12 years. Wow. And that is a watchdog group that has over 4,500 hospitals in their database. And that grade is based on our ability to keep patients safe, to prevent errors, and based on the quality of care we provide. Only 34% of those hospitals in that database receive a grade of A. And we have a grade of A. We are stroke ready hospital certified by Joint Commission and the American Heart Association. We were the first hospital in North Carolina to become stroke ready certified, and that means that we meet very stringent research-based guidelines to provide stroke care that has been proven to prevent death and reduce disability due to stroke. And just this last week, we got notification that the American Heart Association awarded us with several achievement awards. The Gold Plus Award was one of them because we were able to follow those strict guidelines to provide the best of stroke care possible. So very proud of our stroke ready certification. It
should be. That's great, because it shows that you guys are always striving to improve.
Absolutely.
And looking at what's needed and trying to improve.
And we're right here in the stroke belt, so that was something that was very much needed in this community, was the good stroke care.
I don't know how many times you get this question, since we are on the backside of a pandemic, but the cafeteria, open to the public?
Yes, sir. Yes, sir. And it's newly designed. We renovated the cafeteria right before the pandemic, so it's just a beautiful space. And I eat there almost every day that I'm working. I enjoy the food, so yes, come on and come and eat with us. We'd love to have you.
Good food and
good prices.
Good prices. Can't beat good food, good prices.
That's right.
Well, is there anything else? I know we've talked about a lot of different things. Anything else we didn't hit on you want to make sure folks know about the hospital today?
No, I just, we're just happy to be here, to be able to provide care right here in this community, and to be able to keep our patients here locally so that they've got care where they don't have to drive. We serve a very elderly population. It is hard for them to have to drive 30, 45 minutes away to receive care. So we're very fortunate to be able to provide such excellent health care right here in our community. We're very proud of that.
Well, we're proud of you being here, and we appreciate you being part of the community. The reason we're here today is we're talking about our sesquicentennial, our 150th anniversary, and the hospital is a sponsor for our sesquicentennial celebration and some of the publications that we were able to put out this year. And we knew the hospital would be supportive because you are always supportive of this community.
Absolutely.
We're very proud to have you. And good talking to you.
Same here. Thank you.
Thank you.